Welcome back to Let's Face It. I have Dr. Vargas here with me, who has 20 years of expertise in facial plastic surgery. And today we're going to be diving into the emotional and practical aspects of getting a facelift. Dr. Vargas, when women come in for facelifts, what do you feel like the reasoning is behind it? Like, what do you find the most common reason they come in for it?
When people come in for facelifts, it's all different kinds of reasons. But really, the facelift addresses the lower face, jawline, and neck. And the neck is really, when the neck starts to loosen, that's really kind of triggering or noticeable to the patient. So that is what brings the patients in the majority of the time or a significant amount of the time. So just looking down, they notice it. In photos, they really notice it. On Zoom meetings, they really notice it. And when that point is in their life is different for every person. So some people walk in my door at age 75 and they have a really loose neck. I mean, really hangy. The skin is lost its elasticity and they come in and they just can't take it anymore.
Yeah,
that was the day
last minute.
they couldn't take it anymore. And then I have some people walking in at age 40 saying, oh, what can I do? And worried about it. Now, some people always had neck issues, as a kid and as a young adult, they had maybe carried more fat in their upper body and neck area, or they didn't have the projection of their chin or something. So they were always sensitive about that. And so then you add aging on top of that and, they're going to come in a little bit earlier. But some people just aren't, they're more preventative and they want to get in and they just want to find out their options for their neck. And so they come in for a consult and we start there.
When people come in, do you find that it often corresponds with like a huge life-changing event? For instance, my son getting married or a career change, a relationship change, empty nest, and maybe they don't always share that with you, but I would think for the most part, they probably
Well,
would.
I do think sometimes just as I'm looking towards being an empty nester soon, I start evaluating my life, my career, choices I've made.
Right.
And I do think that is a big part of it. Coming in for a consult it's hard for some people.
Yeah.
It's a sensitive time.
Sure
it's a vulnerable time.
That's the word. That's the word.
And go over all of your, insecurities.
Yeah.
And so I always tell my patients, next week, come back in and we'll talk about my my problems.
Exactly. Well, to make them feel comfortable, of course.
Yeah. So what I'm looking for is, somebody may be going through a life change, but that they're stable with it and that they're doing it for themselves. And I always love the way Jane Fonda phrased it in her Instagram.
Oh, I love it.
Yeah. That she's really doing it for herself. Like her body and her face did not jive with the way she was feeling. And so she was just looking for options to change that, to
make the outside match the inside, which I love.
Yeah, I love that too.
I mean, happiness begins on the inside, but it's nice to have your face match the happiness you're feeling in your heart, right?
Yes, or the healthiness and the way people feel about things.
Yeah, that clip, she nails it.
No, sometimes there's work issues. There's people in very... I call it more cosmetically sensitive jobs where they're competing with younger
good Lord.
Colleagues, or they just feel like their appearance is really important for their job, which is most jobs. But so there's those kind of issues as well. But the main thing is just to come together and discuss why they want to proceed, what is really bothering them. And then just to go through, once we decide on the surgery, to go through what is that experience going to be like. So kind of like the things you wish you knew before you had your facelift. Which I loved. So we can kind of talk about that.
Do you feel like, so how do you prepare then? So someone comes in, I mean, and it is vulnerable. I love that word because to me, you can't undo it once it's done. So you're sort of like very much interviewing you, making sure that you're on the same page. How do you prepare women emotionally?
Some of my surgical patients come from my regular clinic patients. They've been doing non-surgical treatments, and we have a relationship. And I feel like I know them. Yeah, they trust me, and I trust them, and we have a rapport. So that's very different than somebody walking in as a new consult for surgery.
Agree.
So during that time, I'm trying to get to know the patient to see if I think their expectations are reasonable and aligned with what I see would be a good cosmetic result. And that's kind of hard on a first visit. Sometimes we have to meet a couple of times. I don't like the idea of just booking the surgery right then and there, but
well,
like
you want to make
letting
sure
the
they're
patient
emotionally stable to start with. We just talked about some of these huge life-changing events. It's like you want to make sure that they're not going to walk in for the surgery crying, like it's going to be overwhelming to them. But how do you tell them to, I guess if I said, okay, I'm going to get this and you want to inform me what to expect. I mean, we can jump into the practical aspects, the physical in a little bit, but for now, like, how would you tell someone, what is this going to look like emotionally for me going through a facelift?
Okay. So first of all, I like to know that they have a support person. So someone, I mean, it can be a spouse, but it could be a sibling or a good friend. It doesn't necessarily have to be a specific person, but just somebody that they can kind of rely on. Now, you don't need somebody tending to you, 24/7. It's not a big surgery like a knee replacement. It's just more emotional support and just knowing somebody's checking in on you. So I always check about that first. Okay. And then after we've met, just kind of making sure, again, on several occasions that they're on the same page with all of us in terms of recognizing that it is a surgery. So some people come in and their expectation is it's just a casual procedure. It is a surgery, and there's sometimes evaluations we have to do prior, blood work.
Right.
We may need a consult depending on medical history. And we just have to make sure that person's a good candidate. But we don't want you having all these bad habits and then trying to turn that around right before surgery. We want you optimal. So we want you really, really healthy before you go into surgery. And so we try to work through that ahead of time. And that's a very important point.
Like, what are some of the things that, be a little more specific about that, if you don't mind?
For example,
what does it look like,
like smoking and drinking. Like, yes, you can,
Bummer.
You can stop those.
If that involves drinking
right before.
Get it.
You can stop those right before, but they're really better if you stop them sooner.
Agreed. Yeah. Well, you want the optimal results too.
Mm-hmm.
That's the way to put it too.
But like something subtle like asthma, somebody might have asthma and the, allergy season brings it out or certain things break it out. But we want to make sure that their pulmonary function is optimized when they come to surgery. Yes. So it's not something they have to deal with or worry about. Any chronic condition, we just want to make sure that they're in the best possible shape. So I had a male patient who was coming in for a cosmetic surgery, no real history on his, and this is a health history, not just that the patient fills out, but we do another one that the nurse interviews the patient and drills down on. Yeah. Then we got a note from the primary, just the surgical clearance, and then there's a history of severe sleep apnea that the patient didn't tell me. And he really didn't have a lot of the risk factors for sleep apnea physically. Right. But of course, there's no sleep study. We don't really know how severe it was. He doesn't use a CPAP machine. He hasn't really dealt with it. So that's something that impacts anesthesia. And I really need to.
Does.
Yeah. And I need to know about that. Well, because I do a lot of my surgeries.
Yeah. Well,
under conscious sedation, but even general, we would want to know about it.
Well, thank God you look into that because...
Well, these are things we can work around, but we just need to know. But it's just an example of somebody who just kind of is downplaying an important part of their medical history because they don't think it necessarily is going to impact us, but they don't know enough.
Well, of course we wouldn't know. We're not doctors, but that's a good point. So always be upfront, clear and open about medical history.
Yes.
Even things that you don't think could impact.
Yes.
Well.
Yeah.
Or could impact. Mm-hmm. Okay. So we get through that and I'm like, okay, I want to do this, but I want to be prepared, and I'm sure people don't ask, you're going to prepare them anyway, because you don't want someone crying in your office on day 3 after the surgery. So what would that, like, in your experience, how would you prepare somebody?
I always meet my patients, again, closer to the time of surgery. So for my in-down patients, I like to meet with them 2 weeks before. Okay. Because if we go through all of the instructions too far in advance, they don't remember, even though it's written down. So we like to go through that all again with them and just any last questions that they may have for me. That's a time where a lot of patients will kind of add on procedures. They've been thinking about it and they're like, oh yeah, I do want to do that laser. I do want to do that. So we have to get through that. And it's an opportunity for them to do that.
Liposuction and some other issues too.
So if it's an out of town patient, we try to do that as soon as we can when they come back into town.
Okay.
But for both, we like to do that, ahead of surgery. Yes. I would say there is a little bit of an emotional roller coaster. It's not just with facelifts, it's with all facial surgery. It's different than body surgery. Okay. So emotionally, it's on your face. You can't get away from it.
Can't hide it.
And it's different. So this is kind of something that applies to all of my patients having facial surgery, but you kind of get excited right before surgery, I'm
excited.
It's coming. Yeah, it's coming. Excited, apprehensive, but excited. And I'll see my patients before and I'll say, you're nervous and, it's okay to be nervous.
Right.
Like are you stressed and nervous? And they're like, no, I'm not too stressed. And then that allows them to share, any anxiety with me at that time. Then they have their surgery and we see them, most of our patients we see back the next day, not all, but the next day. And it's funny, the next day patients aren't worried at all.
Yeah.
They're totally expecting it. They know they're going to be swollen. They're not worried about it. They have somebody who has brought them in. I don't let those patients drive. And so they have good support. We're there saying, yes, normal.
Looks good.
Yeah.
Clean.
Yes. Just confirming everything. Then those patients go home and it's a week before they come in. And over the week, swelling and bruising. Swelling and bruising tends to worsen.
Yeah.
So that kind of peaks around day 3, which is day 1. Surgery day is day 0.
Okay.
So day 3. And then it starts to stabilize after that, but it's not gone. And so when they come at 1 week, patients kind of experience a low. Now, if you're somebody who has a pretty stable personality, you don't go too high or too low, you don't experience this as much. But if you do tend to be up and down a little bit more with your mood, then you can go through this a little bit more. It's just important to be aware. I just feel like if the patients know about it, that's half the battle. Then they have a reason to feel down, and that's normal.
They don't feel weird that they feel like that. It's like you're giving them.
It's kind of like, what have I done?
Right.
I'm still swollen. This is not right. Those kind of feelings. Some regret maybe, or just worry. So we spend a lot of time, again, trying to reinforce that everything looks good, is normal, they're doing well, they're on track. And we correct anything that we see that we might feel is, they're not doing well within washing or that kind of thing, aftercare. And I also like to tell the caregiver ahead of time, hey, this patient's going to go through this downtime, and any little comment, affirmation is helpful. Like, yes, you're bruised, but I can see the direction you're going.
Which would make a huge difference.
Yeah. Little tiny things like that are really important because not everybody is
smart enough to just say that. I'm sorry, let's just say what it is.
And some people are worried themselves. They're like, oh, I don't know.
Well, and you can read that on someone. Like I remember when I got the eye stuff put in, like fat put in, I can't, or out. I don't know, something I got done, but I got the laser under it.
Yes.
I was so excited because I wanted to do this and I'd gone back and forth with it. And you said to me, listen, the laser is going to do wonders. However, it is going to look like raw skin. And I was elated on day 1. And I remember, I know exactly where I was standing in my bathroom when I texted you and said, I don't think the Aquaphor is working. And because it looked raw. And the word, I would highly recommend not necessarily looking too closely in a mirror. Like, yes, wash and care for. And all I needed was for you to say, I remember sending you a picture. And you were like, that's the way it's supposed to look. Believe in trust the process.
Yes.
And I just needed that from you. It's the truth though. And Vince had been like, oh, you don't look that bad, but I can see in the mirror, I look damn bad. Like it looks like you got burnt, which is what you did. And it's like, you just had to say to me, hey, this is what we talked about. And we had talked about it, but that made all the difference. Hearing that affirmation from you, who has seen this 1,000 times, and knowing that I was expected to feel that way, it did make all the difference being prepared. I felt like I was prepared for it.
Yes.
Even though I did cry.
And then sometimes I think it helps when my assisting staff reaffirms, because so the person who, the nurse who pre-ops the patient, they have a bond with that patient. And so, I'll leave and the patient will say, is it really okay?
I do that all the time to these guys. How bad is it going to hurt?
So, and then we see the patient back in a month, and usually around that time, then it's like, oh yeah, no, that wasn't that bad. I could do that again. So they come full
circle. Yeah.
Yeah. Yeah.
Which is beautiful. I mean, I guess that's the goal, but it is important to know that ahead of time.
Now, some surgeries take a little bit longer, to see the results, but by a month, you're really seeing, the improvement, and you're not healed by any means. You're not fully healed, but you're seeing, the process working out. And so, yeah. And most people are back to, more normal lives and work and that kind of thing. So.
And they can see the results coming through.
Mm-hmm.
So that's the emotional part. Now, start back at, I come in for the facelift. I'm talking to you about it. How do you prepare me? Because I have seen some scary ass pictures of people after the facelift. Like, what would you tell me to, brutally honest, what am I going to look like on day?
Do you mean recovery wise or like?
Recovery wise.
Okay.
Oh gosh. I'm talking about the physical, like when I looked in the mirror.
Yeah.
Which you had prepped me about.
So I think, for example, lasering per se can really bother people.
Terrifying.
Yeah. But surgery itself, if you're a bruiser, bruising tends to look worse.
Yeah.
And then people who don't bruise tend to feel better. But really, it's just kind of part of the healing process. And some people just bruise more than others, with the same surgery. So you can't get too down about it. It's just, temporary.
Right.
So, some people, just when you're numbing, you notice they bruise more just from the numbing.
If I were going to get a lower facelift, stitches, because that's what I see that freaks me out.
Okay.
Beyond the bruising. Like, where are my stitches and how fast
as we
do
say,
they?
on the facelift, curls around the hair tuft, in front of the ear.
So it's right there in front of the ear.
In front of the ear, and then up the back of the ear, and then it crosses over and down into the hairline. And there's a couple important points, because I've seen on Instagram quite a bit with incisions that curl down low here, which most people don't do that incision because you would see the incision when you
my
pull
hair's
your hair
back all the time.
Yeah.
So that is a
So we cross over high, and then this incision can be pulled up into the hairline. But the problem is when you do that and this comes up, this hair tuft raises and you get that bald area there. So it's better to accept the scar short term. You'll see it a little more, but long term, it'll look more natural and it heals well.
Okay.
So the incisions usually don't bother people so much for the facelift because they don't really see them. It's not like having a stitch,
thank God.
Right under your nose.
Well, that's what I was going to ask about. Is the stitch under your nose from, I want to do this?
The lip lift.
Oh, see, I'd be getting that too. How long does that take to heal?
Okay.
Let's just throw
same.
that in.
Stitches come out in 4 to 7 days.
But like, that's something you're literally, I'd have to go like this to be seeing the side of my face, but does this heal pretty nicely? It must, if that's what you're doing.
That does heal well.
Okay.
That does heal well. But it has to be precisely close, but it does heal well.
The first week you talked about, like, let's say I come back for my 1 week.
Mm-hmm.
How healed am I looking in terms of, can I go outside? Like just a 1 week.
So 1 week we're taking out some of the stitches. And when you're just taking out some of the stitches, even no matter if you're very gentle, there is some roughening of the edges that you get. And so it's not completely healed. And I feel like at that point, makeup could still be very irritating to the incision. So I would hold off on any of that at that point. Now, if you don't have a laser or anything on your skin, bruising can be covered with makeup.
Sure.
Because you're not putting it, you're not going to get an infection from a bruise with no incision if the bruise is down lower.
What's the laser? Where would you be doing the laser on here? But let's just talk about that too.
So
like what would
personally, when I do my facelifts, I like to do the lift. I like to do some volume and I like to do a laser. So I like to do the skin. So I treat the face, neck, and chest.
Gosh, this is
so
awesome.
Now, in general, we don't go as deep over the facelift flaps at surgery. And that works out because usually you don't have as much sun exposure there. But with the deep plane facelifts, we can actually go out a little bit more than we used to. I tend to go deeper around the eyes and deeper around the mouth and then like kind of a nicer refreshing all over. The skin on the face can take a can take a deeper setting at one time than the neck and chest. And so we do lighter lasers, or I do lighter lasers there. And, we would follow up with more in the clinic afterwards. Okay. So the laser, even if you do a light laser, kind of can be a little intimidating to see afterwards. Patients do that in the clinic. I mean, you don't have to have surgery for that necessarily. So I think people are kind of getting more used to that, but it's like the combination of a surgery plus a laser.
If you're going to go for the surgery,
the volume, and you're swollen,
in my
and
opinion,
red.
It's like let's go big. I'm not going to try to come back in and do that later and then have to recover it differently.
Yeah, and everybody's different, because some people do like to do the least amount and then follow it up with more surgeries down the road, and some people are they like to come in and do as much as they can at one time.
That's me.
And then I don't even see them for 5 years, and they come back in for another surgery. So we touched on the physical aspect of the surgery and a little bit of the emotional part about looking at wound healing on yourself and on your face. But then there's also this aspect of, what do the patients want? Can we merge what the surgeon wants and what the patient wants? One of the ways I do it is I just show them lots of my before and afters. And I'm so thankful that so many of my patients have let me have permission.
I mean, because that's the only way you're really going to show.
It's my work and I can't show them unless I have permission. I just show them because I can promise that I got that result. Like, those are real pictures. But if I take their picture and tweak it with some of my Photoshop material and say, oh, you could look like this if we tighten this, I can't promise that. So I don't really like doing that. I just like saying, find somebody in my before and afters that you kind of look like, or you're about the same age, or your skin type. And
the concerns
if you
are the same,
if you had that result, would you be happy with that? So that's kind of one of the steps in my processes. It's hard because sometimes when you look at before and after pictures, they can be really amazing before and after pictures online. But if you actually see that patient, they're very severe. You can really change the photos depending on lighting and makeup and that kind of thing. And there are probably some people who do that. But I mean, here we try so hard. We try to not let the patient put on their own makeup, and we try to keep things really consistent. And we have a photo room with no windows, and we have the lighting consistent. There are standard angles to see before and afters. And if they're doing different angles than those standard angles, then things may not be
as realistic,
as real as they are. Yes.
Because you see that all over Instagram. I mean, and Photoshop.
Yes.
Would you say that, I mean, I would obviously be using you, but if it was somebody who was going in for a consultation for a facelift with somebody that they hadn't met before, what do you think are things to look for? Like if I were going to go to somebody.
I think one of the most important things is how many of the procedures they're doing. So, I mean, I specialize in facelift, so I'm doing facelift all the time. Not to toot my own horn, but I just feel like that specialization really helps with the surgery, doing it over and over and over, and slightly tweaking it every time, and always making your procedure better. Always making your procedure better and analyzing your results. And so I think that's one of the most important things. But sometimes it's hard to tell that. And I think there can be really strong surgeons in many different disciplines who can do the surgery. So I always say the most important thing is finding someone you can trust. Because also when people present you with ideas of what they want to do, their plan, it can be very different from the next consult you go to. First of all, people can phrase things in different ways. They may put a name to a facelift and it gets confusing. You're not comparing apples to apples. And I'm not saying that that's wrong at all. It's just sometimes it's easier for that surgeon to categorize their different levels of surgery. But it can be just difficult when you're trying to compare pricing, or
the pricing's always going to be
what you're going through or what your recovery would be.
Well, and let's hit on that for a second. That pricing thing, I get it that you don't want to pay them the most of the mostest. In your opinion, I know mine. Would you say to somebody, oh, you really struck a deal here? Go with that. I mean, common sense would dictate no, but do you think that that's a red flag to look for when someone is a lot lower priced for the same whatever? I mean,
that's a tough one.
Yeah.
because there are some really, really good surgeons who have kept their prices low, don't do any advertising, and are not big on social media, but they are amazing surgeons, and they just go by word of mouth, and they just have lower prices. That's kind of how they did it, and they're very good.
Yeah.
And there's some people who have bigger
Inflated everything. Blah.
Yeah. There's also a trend of, I'm noticing on social media, of saying like, you're booked out for a really long time and your prices are really high and this and that.
That's a red flag, right? I mean, that is, yes.
I don't know if it's a red flag, but it's something to keep in mind. I'm just saying, like, you have to find somebody that you can have an honest conversation with, and you just kind of don't want to deal with that stuff. So you just want to sit down and say, this is where I am. This is what I have. This is how much downtime I have. This is kind of what I'm thinking I want to spend, and just go through what are your honest options. And that goes true for the surgeon. They want a patient who's telling you honestly, like, what are your motivations and all that. And so it's a two-way trust. I think that's probably the most important thing, is that you feel like that person is giving you their honest opinion. It's a kind of a gut feeling. If you've spent more time with them,
it makes it easy.
It makes it easier.
No-brainer. I would think for me, one red flag would be going in to meet someone and saying, I am thinking about getting a facelift. And without anyone asking me what I want, and I see this a lot on Instagram, the surgeon going, what I would do is blah, blah, blah. I mean, it's one thing. I want your opinion, but you always say to me first, what's bothering you? Mm-hmm. What are your concerns? I would think a red flag would be someone jumping in with that. You
need this. Yeah. I have a hard time with that too. Like, you need this is this. I think it's okay to say, if the patient says, I'm trying to attain this, then you can say, okay, I think you would need this, this, and this to attain that goal. We love on social media everything to be very black and white. Yes, no, 1 or a 10, good, bad.
Black and white
but
myself. But
it's not.
I know.
And so you could say, yes, this would be a treatment. It would get you here, but you're not going to have as big or a benefit because of X, Y, or Z. And, that's important too.
Well, it's setting the expectations.
And a
realistic expectation.
And yes, and like, okay, yeah, you can do this. I know it's big shiny lights on Instagram, but you really don't have that same problem that the patient did who was on the example that you showed me.
And that's where the social media thing kind of gets us in trouble, because the more you look at it, especially, you get kind of, my gosh, one of my dad's friends said, romanced by the glitz.
Yeah.
You kind of, isn't that great?
Yeah.
It's just like.
So in the early days, we used to call it the Oprah effect, because Oprah had her show and people would go on and say, oh, I had this non-surgical treatment.
Named treatment.
Yes, named treatment. All of a sudden your phone started ringing like, do you have this? Do you have this? And there may be no research behind it. And you don't want to do that, because you don't want to offer it to your patients, because there's no proof that it actually is doing anything. But yeah, all of a sudden you have this pressure from society because all these patients are asking for it. And so it kind of is the same on social media now, but like
100,000. Well, yeah. That's because I was looking the other day at one of even just comparing facial plastic surgeons, they're saying like, what do you think of this salmon sperm something? And obviously this one guy was trying to pump it out because he's like, oh, this is great. And the other guy rated it a -6.
Yep, I know, which gets us into non-surgical treatments that claim a facelift. So this was big in the 90s and early 2000s. Liquid facelifts. I can tell you there's no non-surgical thing out there that equates to a surgical facelift.
Yeah.
A surgical facelift does not equate to volumization or treatment of the skin texture. So there's pluses and, there's benefit to all of these things. We cannot accept calling things a facelift that aren't a facelift, because it's a misnomer. It's confusing.
Yes, as patients, because you kind of think, oh, if I can really do that,
mm-hmm.
Then it's like, what is it? Is it threads? Is that what
threads?
Yes.
Yes. Non-surgical threads.
You saying that is a option instead of getting a facelift, without saying there's a timetable on it, without giving any of so people are calling going, oh, I don't want my facelift. I just like to get the threads.
We can talk about the threads. Yeah. The threads are dissolvable suture with little kind of back cuts. I mean, there's different types of
Right.
threads, but in general, so they're kind of considered barbed, and you can put them in at a certain place and lift the skin and embed it kind of on the barbed suture. The benefit of the threads are very little downtime,
Right.
non-surgical, no major wounds or anything like
Less
that.
expensive.
Less
I'm sure.
expensive. The downside is there's not really a lot of control with the threads, and then you're not releasing any tissue and you're not fixating the thread. It's just kind of hanging out there. So if you rub the thread or massage deeply or do something,
Yeah.
you can get asymmetries easily because
it's like my
one
worst
side or the other. But they're not super aggressive. The other major problem with the threads is, I mean, you can see on myself, if I lift this back to where I want my jawline to be, I have all this creping
Right.
that gets caught around my ear. I can't leave the patient like this.
No.
So you have to loosen it a little bit. So you're kind of like compromising. It's a
Well, yeah, you are,
compromise
like
all
meet in
the time.
middle. What if one side does something wrong, then you just kept to going?
Well, it's not that dramatic. You can kind of loosen it by releasing some of the barbs.
How long will it last?
And it lasts about 9 months.
Okay,
Because
so-
the thread dissolves. Now, I have some patients, they just love them and they come in, every year and get them done. And then I have some patients who are like, I really didn't notice that much. And it's definitely patient selection. It's younger patients without a lot of laxity.
Well, that would make
Yeah.
more sense. Do you think that would be a good way to get an idea of what a facelift might look like on you? Or is that a stupid question? Is that even a...
No, I mean, not really, because you can't really do what you're doing.
control
in
it
a
as much,
facelift.
obviously. Yeah.
Yeah, you're always just kind of
Okay,
like
so we won't be doing that.
mimicking
then.
it.
Just an
But,
idea I had.
if you had photos or, some event and you wanted to do that, I could see it for that. But you think of it more like temporary, very temporary, like fillers, not like a surgical
That's
procedure.
that's a really good way to compare it. It's like a filler. So
Yeah. But we all age and we have to come to terms with that. And this won't stop our aging
No.
process. We're just going to, we're trying to look our best day.
version of
every
ourselves,
single-
our
yes,
best version of ourselves.
every single day.
And I love that
So-
Jane Fonda said, like, when she walked by, because I do think for me, it's like Botox. I always say, like, I'll wake up in the morning, I'm like, it's gone. It just left last night when I was sleeping. And I think there are just days when you look in the mirror and something that's bothered you a little bit, it's just like, enough.
Mhm.
I want to go deal with this. And I think that there's nothing wrong with that. As long as it's your personal journey, that it's not someone telling you, because I do have friends that I know that, their husband's like, do this, do that. And thank God I don't have a husband like that. He's more like, don't do it. And I'm like, listen, mister, I'm going to do what I want.
Yeah. Yeah.
There's got
yeah.
to be that dynamic going on. But I do think that the most important thing when you're doing something like a facelift that people see every day and is not reversible is that it's what you want to do.
Mhm.
You have a realistic expectation of it. And you're not going to look the same as the 21-year-old picture that I stare at all the time. Like the college pictures, I'm like, oh gosh, I did not appreciate.
Yes.
You know what I mean?
Yep.
And I say I want to be 21 again. It's not possible. So I like what you're saying.
Yeah, you don't want to be 21 again, but you just want some
I
of the
kinda do.
features of your 21.
I do want to be 21 again. Now, that's not true.
Yeah.
But, I agree with that. And I think realistic expectations are the key. So,
Yeah.
I guess reiterating, getting this facelift, finding the right doctor that you trust, getting very upfront and brutally honest about the physical
Mhm.
expectations and the recovery expectations, the emotional and the practical aspects of it would probably be the most important things to do.
Yeah. And I think one of my nurses says a lot, and I really think this is a good point, is once you just commit to doing some procedure that's going to make you look or feel better, that you really commit to improving your life. Like we were saying, you commit to your health and trying to optimize your health,
Right?
but also getting rid of the habits that you've, the bad habits that you've collected or
Continue to
accrued.
collect,
Yeah.
like me.
All those years. And so you get into, you start refocusing on nutrition and exercise and all those other things. And you just try, it's one piece of that longevity puzzle, and you try to commit to that whole thing.
That's good advice. I like that.
Mm.
Well, I think that we have really given a full, honest picture of what this is going to look like. And I'm personally very glad because I have all these questions are realistic to me because
Yeah.
it's something that I am strongly considering doing. But I hope that we helped the listeners understand that a little bit better today.
Yes, yes.
Is there anything else that you want to add before we wrap up here?
I was going to kind of go over a couple other things that I've heard online that people kind of wish they knew before they had the facelift.
Yeah, debunk.
So a couple of things are, when we lift up tissue, that area can be kind of numb after surgery. If you have any scars from any other surgery, if you feel the scar, but a lot of the scars that we have were an incision and just opened.
Right.
But the facelift is where things are kind of peeled forward.
All the way.
And so there can be more extension of numbness on the skin, and that's temporary and that will come back. It can take, 3 to 6 months for that to come back. At a year, nobody really notices it, but some slowness of that, which is, sometimes good because it doesn't really hurt you as much.
But also it could kind of freak you out if you didn't know ahead of time.
Also, incisions. Some of my patients, they really can't see the incisions. If somebody's looking at them, then they may come in with issues or questions. But, you have to have a staff member checking those incisions to make sure they stay flat. Every once in a while, I get somebody who, kind of lets things go. Just if you feel like anything's wrong, follow up and let somebody check it out.
I'm like the opposite.
Yeah.
I mean, you want to block me.
Yes.
Yes, I do.
There's a funny thing that happens, and I've started pointing this out to all my patients. If you pull your ear forward and run your finger on that little crease.
Yep, I feel it.
About 3/4 down, there's a little notch, auricular muscle.
It is.
That some patients, can wiggle their ears and can engage those muscles.
No,
I can't either. But that's normal and everyone has it, but you never feel that on yourself ahead of time.
I never.
But then after, when people are feeling their incisions, they run over that and they're like, I have this big notch on the back of my ear.
Oh my gosh, I would be the person that did that.
Yeah.
100% the person that did that.
Yeah.
Just little things like that.
So I kind of point it out now and say, feel this. This is normal. This is your normal anatomy. You'll still have this notch. Afterwards, the scar will go over this, but that will be there.
Feel it.
If people are having different anesthesia is another thing we can get into, but if people are having general anesthesia, they can have a sore throat after surgery. So some soft foods can be helpful. Also soft foods because of they can be sore kind of on the sides of their face, chewing. Yeah. No, you don't have to go with a liquid diet, but if your throat is sore from general anesthesia, then soft foods definitely help.
Yeah, I get that. Do you tell people, I should ask this earlier, when you're saying optimal health, are there medications like that you say, obviously, like ibuprofen? Do you cut people off before? Yeah.
Oh, yes. So,
and then after.
Definitely. I have a list of medications and we can list those.
And you clarify that with them before.
We clarify that before because some are prescription. And so we have to work with their primary care or their specialist.
Gosh, Motrin and Zoloft, I cannot go off those. Those are not on the list because the crazy is just got to be reined in a little bit.
Okay. Well, yes, we don't necessarily like people to stop any anxiety medications because we don't want anxiety to flare before surgery. But we just want to know what they took.
Yeah.
We want to know what they took.
So
that's what we tell people. On one side of it, it is a surgery and there's an incision there and it's going to be a little sore. On the other side of it, in the terms of pain, it's one of the lower and less painful surgeries that we do.
Really?
Yes. So
even with lasers?
So lasers can be sore, but they're usually
the way it looked
temporary.
That's what I'm thinking.
It's very temporary.
It didn't hurt.
But I'm saying the facelift itself,
like pain-wise,
is oddly usually not painful. We have to treat people where they are,
right?
And if they are in pain, then we treat for pain. Yeah, but
do they have pain meds like? After it's done, what kind of medication are you on?
The way I like to do it is I like to separate any narcotics from Tylenol, do them separately.
Yeah.
And then I like them to take round the clock Tylenol, kind of keep that going on board, and then only take the narcotics if they're feeling like more severe for those times where they maybe have a little breakthrough pain. But about half of my patients actually get by just on Tylenol, not to put pressure on people. And there's no reason
I have a hard time.
not to take
pain
it.
Meds I really don't do well.
There's a lot of complications and side effects from pain medications. So just some patients really want to avoid it.
Yeah. But so you could do just Tylenol.
When patients have a facelift and other surgeries done, body surgery is much more uncomfortable in general, very much more. And so most of the patients, when they do have I don't do body surgery, but when they do have body surgery, in concert with maybe something I'm doing on the face, they don't even feel their face.
Yeah.
Because pain works like that. You kind of forget about the lighter pain.
Yeah. What about the lip lift? What about this? Is
Not
this
too
sore?
bad. Not too bad. No. Afterwards, not too bad. Yeah. So stitches generally come out around 1 week for most patients, for most procedures on the face.
Right.
So that's done, but that doesn't mean all the bruising and swelling is cleared up at that time.
Or even
And
the
that's
incision area you said might be a little
variable.
bit. Yeah.
Yeah. And facelifts, people are very creative about covering their facelifts. And I've had several professionals who go back after a week, but I don't recommend that.
Right.
And I don't like people to put the pressure of having to return super early because then they feel like something's wrong and they're not recovering right. They're like not on track, but it can be done. But I would say more after the second week because a lot changes in that second week and, you can go back. Now, if someone really looked closely, they probably could see evidence of surgery.
But you can use makeup by
you can
week
use
too,
makeup.
right?
And,
That's a huge difference,
Mm-hmm.
like aesthetically.
Yeah.
Because those are separate.
And then the one
monsters.
that's a little bit harder to cover is nose surgeries. That's not really aging face, but there are some aging changes to the nose that happen in certain types of noses. So it can be included in that. It's a little bit wider and more droopy. It tend to be. Sometimes you can see the hump more as time goes on.
Right.
But
We're adding things on now.
Yeah, we're adding things.
We're saying that just normal facelift.
Mm-hmm.
So you would say a week
I would
to
say
2
2 weeks. Yeah. And it depends what they do because a lot of it at that point is aesthetic downtime.
Yeah.
It's like, do you want people to know that you've had something done?
Do you want to look like you're
Some
beat up?
people can do work from home. Some people can do Zoom and then they can go back. They could go back after a week if they're comfortable. It's not like there's something wrong with them that they can't do work, but they might be a little more tired. So I tell them, work and, do a couple hours of work. If you feel exhausted, take a day off and, use your judgment. And it's kind of like exercise too. Like you can go out and walk. Don't walk 10 miles the first day. Just slowly go out and walk and see how you feel. If you, don't feel well, then, take a couple of days off and use your judgment. The only thing on the necks I don't like people to do is twist their necks.
For how long?
6 weeks. So I don't like people to really do aggressive yoga positions or tennis or pickleball.
What about like lifting weights?
But if you get to a point where you feel like your swelling's significantly down and you want to start doing a stationary bike or walking on a treadmill or doing some weights where your neck is stationary.
It's really the neck you're talking about.
Yeah.
That's like the place to be.
Yeah.
And do you think,
and like,
you feel it like if you feel it tweaking?
Well,
do you feel that, or is that something you have to be hyper?
It's not like there's only one stitch holding everything up, but I think it can stretch the sutures. There's no scientific study behind that. That's just my thoughts on it. One thing we could get into, we didn't really talk about, is body dysmorphia when we were talking about expectations. So there is a condition where patients tend to focus on one part of their body and they having exaggerated anxiety about that one thing.
Like hyper-focused on it.
Hyper-focused. They generally are less satisfied with surgery because it's not necessarily all the physical traits that bother them.
Right.
So they just can't be happy with it.
No, I was just going to say some people just will never be satisfied.
So you try to, trying to suss that out ahead of time in the consultation. But it tends to be younger patients, and a common area where we see that is on the nose. And the nose is a harder surgery anyway, and it's very hard to make somebody's nose look like somebody else's nose.
Which is what they're going to do. I'd like to have this movie stars.
They bring in pictures, and so you have to go through a long talk with that. But you may think you're working through that problem with the patient, but sometimes you're not, and it's just underlying, and you really have to recognize that.
You can see that though in patients. Like, what do you do then? What do you say to them? Do you just be more realistic about what this is going to look like? Or?
Yeah, you have to be really, really careful because it's a real emotional time for them, and they might need to wait till a different time in their lives for surgery.
Well, and that kind of goes back into when you said, you want to make sure, even if the patient's going to be emotional getting a facelift, but you want to make sure that they're emotionally stable in terms of, because otherwise no one's going to win in that, right? No one's going to be happy. So that would kind of go hand in hand with that.
Yeah.
And sadly, I think a lot of younger people unfortunately are exposed to a
Well,
bunch of
the
weird
beauty,
stuff.
I mean, one of the things I've literally had patients come in and say, okay, they did some filler or whatever. They're like showing me a celebrity and saying, why don't I look like that? What are they doing that we're not doing? And, there's nothing that they're doing. The medicine is the same, whether the medicine's in LA or Kansas City. It's just you're starting with somebody who's
Not
super
you.
attractive.
And also not you.
They weren't you when
I'm
you guys
sorry.
were both 20, and they're not you when both of you are 60.
No,
So
and
there's
that's why I
just
do the hair lady. I'm always like, I'll show a hairstyle and I'll be like, this is what I want my hair to look like. And I'll go, I would also like for my face to look like her. And it's always funny, but it's hard to stay away from that. It's also extremely unrealistic, I think, to give a certain picture and say like, okay,
Yes.
Dr. Vargas, make me look like this.
So I'm just trying to give people some ideas to think through what they're thinking of when they're coming to see
what
somebody.
bothers them? That's what you always say to me, regardless of whether I'm getting filler or Botox, talking about a surgery. And I think it is like, to me, one of my favorite things about you is that it's not what you are trying to impose upon me is what you see as problematic. It's what's bothering you. Like, what is driving you bonkers? What are you looking in the mirror at that you're just, and then if I say it, then you can be like, well, you'll explain the options. But I don't think a lot of surgeons do that.
Also,
if I'm being honest.
I think, to say, okay, this is bothering you. And then what about this?
Yes.
So you can kind of lead the patient a little bit into seeing what you're seeing. But it's a combined
collaborative effort.
Yeah. Mm-hmm.
And that's what you do a beautiful job of, because I just, like I said,
well,
I think
you,
a red
Amy.
flag would be that, oh, you need to do this. I mean, nobody likes that in any facet of their life. But if I want to feel my best, that result's never going to come if I don't express to you, this is bothering me. I want this fixed. So big collaboration with you.
Yes.
That's what I like. Okay. To wrap things up, I think choosing to make a change for yourself, whether it's a facelift, an exercise routine, I don't want to use the word diet, but nutrition, changing the way you eat, it should feel empowering. It should feel like a personal choice, doing something for yourself to feel like the best version of yourself. Look and feel your best. Whatever that looks like for you, which is going to be different for every single person. So
exactly. And getting the right consultation to kind of go through that and hit what you need to do to get to that point is so important. So find somebody you trust, find somebody you like, and go forth, if you're comfortable.
I'm about to go forth. So I love the go forth part. And to everybody listening today, thank you for listening. Be sure that if you're enjoying this, that you can subscribe, rate, give us feedback. Feedback's awesome. Tell us what you want to hear about. And we really appreciate you listening today.
Yeah. Thanks so much.